Hello everyone, my name is P.A. Clark and welcome back to our Diamond Dissection where we're looking at the features and the problems that comes along with either over-injecting, under-injecting, or just downright injecting poorly. Let's fast track into our first photo. Now, if we look at this photo, we can see that she's obviously had something done because she's trying to express her eyebrows up. And what's happening is her left eyebrow is sparking upward, meanwhile the right eyebrow is natural. This is a very common mistake that's made. This doesn't necessarily mean that this was botched. It was just done poorly. And sometimes, yes, it can be botched. But remember, when you're having these treatments done, we cannot see behind the skin. We have to estimate what the muscles are doing. Based upon experience, 99.9% of the time, this will not happen. So if something like this happens, it's yes, the injector either wasn't paying attention or just doesn't have a good enough technique to stop this from occurring. But it is possible in a very few cases. Okay. Let's look at photo number 2. This is a classic example of either over-treatment or just not paying attention. And now it would be great if I can see this before picture. But let me preempt by saying these are not our photos, so we don't have the prior shots. I'm basing my opinion from 20 years of injecting and seeing a lot of different circumstances within these patients.
Hey, P.A. Clark, can I ask you a
Sure.
question? Are you seeing that like she's hooded? Is that what it is?
Yes, but there's absolutely, she's naturally hooded, but also that could be propagated or emphasized by poor placement of the Botox.
And is it fixable? Like, how do you fix it?
This is not fixable. This takes time. After roughly 2 to 3 months, her lids would respond back to where they originally were. But that's 2 months of walking around looking as though you've had a stroke. So yes, this is very, very hooded where it's crossing over her iris. Yes. So is this botched? Yes, it is botched, meaning it was done poorly. Now, if I ask what muscle was treated to make this happen, there are 2 muscles that could be treated to make this happen because of her age. You can tell she's over 30. Therefore, there's 2 possible reasons that could occur. Either over or poor treatment of the forehead, which ultimately drops everything, the brow and the lid, or poor placement above the eyebrow, which caused hooding or drop of the lid of the eye itself. So one of these 2 scenarios can happen, and yes, this is a botched case. No one should have this result 20 years after Botox has been introduced. Okay, let's go to our next shot. And here we have classic example, almost similar to the prior photo, where on her right side looks very lazy, and on her left side looks very surprised.
Sorry to cut you off, but neither of these are correct, right?
Correct. Both sides looks like they weren't done absolutely well. And the reason for that is, again, poor placement of the Botox. Botox is a very powerful product, and you should not take it lightly and just go to someone down the street or in some spa that's just popped up. It's a very powerful drug that can cause you severe harm. What do I mean by harm? It can cause you financial harm, psychological harm, or physical harm. In these cases, I believe the harm here is more psychological. Yes, there's some physical harm, but that doesn't really mean she's going to have a massively negative outcome. It's a psychological harm that occurs. When you have to walk around like this, your self-confidence is going to be depleted. You're just not going to like the way you look. Can I ask any of my crew, have any of this ever happened, or do you know of anyone that this has happened to?
I've known people that it's happened to, but considering I've only allowed you to do my injections. It's never happened to me.
That's a good thing. It does happen, and unfortunately, it's pretty much poor technique. And as I said, 20 years after Botox introduction, if this happens, it's because the medical provider probably isn't up to date with their medical or aesthetic injectable training, or maybe they just had a really bad day, they weren't paying attention, and unfortunately the patient experienced this negative botched result. So in terms of aesthetics, this is botched.
And what area was injected for that to happen?
So two things could happen. The forehead, definitely. Whenever we have changes, negative changes on the brows or the lids, it's because the forehead was attempted to be treated. So the muscle in the forehead is called the frontalis muscle. This frontalis muscle are two broad muscles stretching from the top to the bottom, and they kind of interdigitate with the muscles of the corrugator muscles that runs below the eyebrow and up across. The forehead muscles operates the eyebrows up. Therefore, if it's overdone, the muscle relaxes way too far down. There are different things you can do with your technique to make sure that never happens. Is it still possible? It's unlikely, but it does still happen. Let's go on to our next shot. Now this is called puffiness or puffy lips. And this is near and dear to me because the eyebrows and the lips frame the face. It frames your face. If you think you're beautiful and your lips are not done and they're small and you've done your lips, you will love yourself even more. Why? Because you're framing the face. So lips are very important. Overinflation of the lips to have this look is a very bad thing in the long run. It doesn't do you any physical harm now, but it does physical harm years later when your skin is overstretched, especially if you're above the age of 35 or 40 years old, where the skin doesn't want to bounce back after it's been expanded. So in her case, she was over adjusted in the upper lip, under adjusted in the lower lip, but beyond over adjusted in the upper lip, the product, the dermal filler product, is way past her vermilion border, which is that white edge on the very top of the lips that demarcate the beginning of the lip and the ending of the skin. Those two intersect. So if she's overinflated, this will cause this puffiness, or in some cases we call it duck lips, or this ducky lip. This is really not a good scenario because it makes her chin look smaller. It actually paints a picture of someone who is insecure. Therefore, the projection, what you're projecting to others, is insecurity, indecisiveness, and poor decision making. So this is what I talk about, the psychological harm that's done. So Botox and fillers is not just a light treatment that doesn't really cause problems and you know, as long as patients don't die, nothing's going to go wrong. No, this is true psychological harm that can occur to patients, and we have to be very careful that we don't harm our patients, because one of the pillars of medicine is to do no harm. That means do no physical harm, no psychological harm, no financial harm. Let's go on to our next image, and that is going to be same scenario. So full disclosure, this is the first time I'm seeing these pics. These were pulled off the internet for my judgment, discussion, and so forth. And this is another instance where quite a few things looked as though they were done. Cheeks looked like they were done, tear troughs looked like they were done, the lips looked like they were done, marionettes may or may not have been done, chin may or may not have been done. But overall, the harmony of her face is not there. So many things were done, but the harmony of her face is not there. And one of the things that I speak about is over-injecting the lips, over-demarcating the lips, which create that full or that duckish look. Some people like it, some people don't. If my patient does not want that, does not like that, I will not give that to my patient. Is there anything else you may see on this image?
Well, my question is the migration part of it. So did this filler move?
That's a very, very interesting point. Now, some fillers are notorious for migration. Migration occurs when the product slightly moves from the site of injection. And migration can happen in any direction, up, down, across, inside, or to the surface of the skin. I do not use products with a high percentage or propensity to migrate. Depending on the science of the product being used, migration would either be high risk or low risk. You must make sure that the product being used does not lend to a higher amount of migration. Otherwise, what do I always say? Do not sleep on the face. If you apply pressure to a product that migrates, it's going to migrate. So what is migration? How do we look at migration when it comes to fillers? Well, one of the things we look at is with the product itself is the ability for the product to move from where it's injected. What causes that? There's something to do with the weight of at the molecular level of the product being injected. High molecular weight, low molecular weight, cohesivity, G prime, G double prime. These are all the rheologic values assigned to the products being made. Based upon the rheologic value, your product will or will not migrate, especially under pressure. So if you do have a product injected and it has a high probability of migration, and you in turn sleep on your face on that product, you would force more migration. So what is the analogy? Some individuals find it necessary to have an analogy to understand the product. Well, take a sponge, take your everyday sponge, and you take a dishwashing detergent, and you use a syringe and you inject that dishwashing detergent in the center of the sponge. Meaning you cannot see the detergent on the surface, it's injected in the center. Now apply pressure to that sponge and what's going to happen? Your detergent will ooze to the side. That is migration. And that is exactly what happens in the face. So if a product with a high propensity for migration is injected and you go home and sleep on the face, it is not your fault. I mean, you shouldn't sleep on the face, but really a product with a high propensity to migrate should not be injected in high traffic areas or areas under the influence of the weight of the head when you're sleeping. Therefore, the science of the product matters in your final result as well.
So where would you want to use products that have higher
migration? Yeah. Areas that are soft, that requires a lot of fullness. Lower cheeks, temples. Those are the areas that does well. Also in terms of body treatments, hip dips. Hip dips are wonderful for products of this nature. However, if you're looking for precise treatments with precise definition and outline, you cannot use a product that moves wherever it wants to move. Then there's no control of the product and you definitely will have negative results. If not at the time of treatment, then later on.
Cool.
Okay, now let's move on to the next shot, which kind of really, it looks as though she has an allergic reaction to the product. The reality is, and I can spend 1 minute here, is most of these products do not lend to allergic reactions. Most fillers don't have allergic reactions attached to it. The allergic reactions are typically attached to other scenarios and other products. But when it comes to dermal fillers are hyaluronic acid. Most individuals are not allergic to dermal fillers. I haven't seen a case where someone is allergic. Now, there are scenarios where you can have delayed lumps and bumps. Some individuals may call it granulomas, but they're not true granulomas. They're just lumps and bumps. Lumps and bumps are caused by poor placement of the product. Now, this individual with her upper lip being so large, in my opinion, this looks like this was a dermal filler that was injected with techniques that are not necessarily great techniques. So I can see precisely 5 injection points that were used on her lips, and I can see also that she will have a high degree of bruising and swelling within the upper lip beyond what she has now. So she has the beginning stages.
Terrifying.
She has the beginning stages of high side effects and adverse events on the upper lip, meaning that this shot, this result has probably been less than 24 hours after her result, and this is what it presents with. So this would definitely get a little more swollen. She would have hematomas. Hematomas is blood that has oozed into the adjacent tissue and starts to solidify. It can cause a lot of pain. It can cause a lot of swelling, and that's what she will definitely have here.
Is this
Due to improper injecting and over injecting?
I would say it's hard to say. I can definitely say it's poor injection technique. The quantity of product being injected is hard to say because most of what we're looking at is probably fluid swelling.
Yeah.
Remember, swelling is fluid. The worse the technique, the more swelling you have. Some products may have a higher degree of swelling, but it should pale in comparison to what you're seeing here. So if you're getting black and blues and swelling and disfigurement, this is disfigurement and this is a true botch. It's always the injector. It's never the product. The product is just a tool. It's the person using the tool. If your carpenter is working on your roof and the roof is not done well, he cannot blame the hammer. He cannot blame the roofing material. He chose the hammer and he chose the roofing material, and therefore in this case, the blame solely fits on us as medical providers. If us as medical providers blame ourselves, then we start to become better. Then we start to see our faults, and then we correct our faults, and we do get better. That is it for this episode. I hope it was entertaining but also very educational. Please click where you need to click to join our force, to subscribe, and also mention within the comments any disagreements or agreements you may have, any comments you may have, or share any photos you may have with us so we can discuss on our diamond dissection of the face. Thank you.